Hi, I'm Dr. Tani Ping, consultant obstetrician and gynecologist, and I will start off with cervical cancer, which is the commonest gynecological cancer. Okay, first of all, do you all know where is cervical cancer? I'm going to show you a picture. Yes, this is a picture of the uterus, the tubes, the ovary, and that's the cervix. So this is the cervix, this is the place, and this is the vagina. So when you have sex, the place where the penis and the uterus will meet usually will be at the cervix. That's where they bump with each other, and that is very important. I have a reason for why I want to explain that. So that is cervix, that is cervical cancer, and a lot of people actually very confused, They're very confused whether it's cervical cancer, uterus cancer, because everything seems to be part of the uterus. Cervix is just the lower end of the uterus. You can see in the picture, it is the lower end of the uterus. We all want to know the early signs before we get the cancer. Before you get the cancer, are there signs? Rarely. Most women don't know. They don't know they have HPV infection. They do not know they have pre-cancer. They only know when cancer is already there or going to be there very soon, or have already been there for quite some time. Because what are the signs? Number one, you have discharge with blood. Sometimes you have discharge and you see a little bit of blood. You see that little red line there. That is one. Or you see blood after having sex. You have sex with your husband, and then after that you see got blood. Either on the spot or the next day you see blood. Then you need to worry. And of course, the worst case is their discharge. A lot of discharge and very smelly. Very smelly vaginal discharge can also be a sign of cervical cancer. Okay, so these are the signs. But other than that, there are no way. And sometimes when you have these signs, you are probably almost getting the cancer or already having the cancer, so it's also a bit too late. Pre-cancer, that means way before you get the cancer. Are there any signs? No. There's no signs at all. Your discharge can be totally normal. Okay? So these are the signs of cervical cancer. Number one, we know that cervical cancer is due to a virus called Hpv virus. Hpv virus, which is a short term for human papilloma virus. So, cervical cancer is due to Hpv virus. And if you see, just now I did tell you, the cervix is so deep in, right? How do you think virus is going to reach such a deep structure inside? How do you think it's going to reach? Simple. It reaches because you have sex. So, HPV virus infection is transmitted through sex. So, if you have no sex, then there's no HPV virus and there's no cervical cancer. So simple, right? So first thing, you need to have HPV virus infection before you can get cervical cancer. That's the first criteria. Second, once you get the virus, does it turn into cancer straight? No, it takes many years, maybe 5 years to 10 years before it becomes cancer, depending on which HPV virus you get. There's so many HPV virus, almost 100 of them. So there's so many. So some are very much fiercer, turn into cancer faster, but faster also it probably will need 4, 5 or 6 years. Some are slower, maybe it will take like almost 10 years before it becomes cancer. So HPV virus, first thing you must get the viral infection first. Number two, is your body able to get rid of the virus? If you have very strong immune system, you also can get rid of the HPV virus. So you get the virus and then you don't even know you got the virus, and then after you got rid of the virus already, and then you also don't know. That would be the best, isn't it? But unfortunately, certain group of women, they cannot get rid of the virus. So this virus stay in the cervix. We call about persistent infection. That means the virus is there for a long time. Long time is how long? Years. Many years you still keep the virus inside you. So if you test for HPV virus and you detect the virus, this year you detect, next year you detect, another year you detect, every year you went and check your virus is still there, then of course your chances of getting cancer be very high. Okay, so that's all for tonight's. Do stay tuned for next week. Thank you and bye bye.